Maybe we should be envisaging a renaissance in healthcare. And there's technology there, but a lot of the vision goes into what the future of the workforce is. That seems to me like a real renaissance in the healthcare, right? And that we can create the capacity. But when I look at the current system, there is a deathly silence of that emerging and coming through. Deathly silence. I would argue we're going in the other direction, and that technology is becoming the end and not the means.
Hey everybody, welcome to another episode of the Healthtech Podcast. With me this week, I have Liam Cahill. And Liam, I'm delighted that you've stepped in. We were just talking, actually, weren't we, about the fact that for some reason, believe it or not, listeners, a lot of my guests are cancelling at the moment. Like, how dare they? How dare they cancel such an amazing opportunity because they're busy building important businesses? And so Liam kindly stepped in after we exchanged a few texts yesterday. And I was like, do you want to just come on the podcast? So obviously delighted to have you here, mate. You've been on the Pigeon podcast and it's a pleasure every time. So yeah, looking forward to actually getting into this. And can't believe, it's like Keith Grimes coming the week. Can't believe that you haven't been on already. Like, it's just one of those things that I just assume you have. We talk that often. So you express a lot of interesting opinions on LinkedIn, or perhaps you just express opinions on LinkedIn, which, as we're saying, not very many people do and stick their neck out on. But as a result, I think you've got a really good following. You're developing your course for how to sell to the NHS, which is obviously a topic which a lot of people want to hear from you on. So, lots for us to talk about. And of course, we're probably going to put the NHS to rights, the health tech world to rights. Looking forward to it, dude. How are you?
I'm really well. As I said to you before, the sun's out. I'm planning for a golden summer. I'm building something really exciting. And then Beautiful. My partner, Mel, is also building something really exciting during September. Wow. So it's like big, exciting times at the moment, you know?
That's fun.
Yeah.
Good stuff, mate. Well, listen, as you know, the way we start these podcasts is for you to tell your story. I want to get into some of the meaty parts of the conversation relatively quickly afterwards. But yeah, what's the journey to this point, mate, and what leads you into everything that you're thinking about and talking about at the minute?
Yeah, so I think on some of the other talks, the podcasts that I've been on, I've kind of sort of done sort of a more extensive thing around how the hell I ended up working with a load of tech companies. But I think today, I'd really like to, I suppose, take a different view of things. And I kind of want to focus into, I suppose, from about 2010 to 2018, when I was given a crazy opportunity as a young person to basically operationally build what ended up being a national social enterprise in the NHS, a couple of million turnover, that was helping the NHS to a number of clinicians to save money without reducing cost, which of course is still very much here. And 14 years on, it's been the thing the NHS has been looking at since the financial crisis. But I think what that schooled me in, which I never really expected, James, was that it gave me so much insight into how fundamentally sort of rigid and mechanical the NHS was, and how much it really struggled to kind of get so many different things done. And I think it started putting some seeds in my mind. So we grew, I was chief operating officer. I suppose built a lot of the vision for what we built. It was very, tech enabled and very digital as an organization. But more than that, I think what we started to do is have a philosophy around how can we empower a community and do things differently? How can we not be a provider too, but a community of people who can work together in different ways and collaborate and be productive? And I kind of got to the end of that journey and I started sort of thinking, we're going into an industrial revolution. We know that we're going from a logical to a social emotional sort of shift in society as technology comes in and changes things. Like, how is it possible to do that? So a lot of my time since I left in about 2018, 2019, which I think is when we sort of first met after through a gentleman called Stephen. And time goes by, right? Only 5 years since then. But I think what I've been doing is I've been working quite a lot on the system side to actually try and sort of understand how can we be less linear, less reductionist, less mechanical in what we do. So a lot of what I do is go into organizations, and I do what I call sort of Trojan digital. So I'll go in, and my job is to go in and we'll find ways to use technology. And what we'll do is we'll use that as a way to expose the problems in the organization. And there are lots, like, any technology company that you've spoken to about 5.6 million tech companies in this, right? That you speak to, will generally say how hard it is to get through what the NHS wants. And I suppose what I've been doing is working with providers, national bodies, a lot with the Health Foundation on what is the next paradigm of care. And this has just been, I don't know, it's just filled my soul, if I'm totally honest, right? And it's become, I think, what is now my main mission in life. Like I think on LinkedIn, as you say, I've got quite a following around stuff that I tell health tech companies. So my general headline nowadays is I help the NHS not fall over themselves innovating. I help people to understand how they can fall over the NHS falling over themselves innovating, So, and then everyone's falling over together, which is probably a sign of the times, right? And so I think, what I try to do is I try to look at actually how we can move, like, we're going through an industrial revolution that is moving us into a rhizomatic digital society. That means the shape of how society functions, like the previous industrial revolution, will dictate what the fabric of society is and how we work. So that goes down to teams, services, organizations, local systems, national systems like health and social care, societies in itself, And, I do a lot of work with the military at the moment as well around sort of how they can shift, how their institution can address some of the big, hairy problems that they're facing. And actually today is the last day of mentoring 13 military leaders for 4 months, which has been such an amazing privilege. Wow. But it all comes down, I suppose, to this of, right, we look at technology in isolation. Many people don't understand it, and many people don't see how we can be empowered by it. And yet we've got this huge shift going. And how do we navigate it? And what are the things we need to put in around it to make sure that this can work? And so that is generally what I do with systems, national bodies, arms length bodies, and so on, whilst also helping health tech companies at the same time. So
awesome. Yeah. Awesome. One thing you mentioned there, we're moving from a logical to a social and emotional society. Are you talking about the role of human beings, what human beings spend their time on, how human beings work? And are you talking at large there? You're talking not just healthcare, are you there? You're talking that actually
all of us,
we go from being beings that respect the logical of each other to actually no longer needing to. And that's interesting.
Like, I think if we go back to the first machine age, the Industrial Revolution happened, 94% of people worked in agrarian jobs. So, and most of that was that the value of them to society was that they could pull a plow, or they could pull something out, or they could do something which used their physical energy. So the vast majority of people in society across the world, and still in some societies now, their value was physical power. The first Industrial Revolution came along, and what it did is it created this new power, this new kind of power, which was coal, steam, all of these different things that then replaced them. And so what we then had is the creation of the industrial age. The creation of the industrial age created, had a Newtonian mindset. So what that started doing is saying, we move all of these people, we move them into logical jobs. So, a lot of people who may have been weaving would have then been thinking about lots of different areas. Okay, that thread's going, they wouldn't have been doing a physical job. They would have been physically intervening to make sure that maybe a larger loom would have been able to do it. And as we've gone forward to this particular age, we are now arguably coming to the end of the Newtonian mechanical industrial age. Now, the shape of those times, right, without sounding a little bit woo, but the shape of those times was, the thinkers of the time were the principles of modern management. The philosophy of the time was, we will break things down into the component parts and we will use them to try and achieve perfection in those individual little nuggets that we have, right? And if we can do that, that equates to success. Now, societally, we've all moved across into largely logical jobs. Maybe not you and me, but I think, maybe our parents would have done things that are a little bit more logical. And so in this will be, I suppose, two particular things. There'll be one, what I think about as process logical. So I will see it as a thing. I will take that across that thing and do that, right? And the other thing is I need to make a decision about something to happen. Maybe not an emotional decision, but a logical decision. So if I went for a beer with a GP the other day who was talking about, we were talking about like how much of a GP's job is logical, right? So, if we take this conclusion to where we are in this current time, right? We've got a GP someone will come in, they will provide information. They will receive information. I might get some angry GPs from this, but this was a GP who said it, right? They will receive information from a database of information. They will then have a discussion with them to correlate the two to come up with a diagnosis or a decision. As a consequence of that decision, there may be pop-ups and prompts that come into this, right? And then as a result, they will then make that decision concrete. They'll put it into the system and do so. Now, of course, there will be elements of social emotional, or I think if you speak to your average general practitioner about how much time they actually get to collaborate and connect and to do those areas of things, like they will say that, it's interweaved and all of it, of course. But ultimately, many of our jobs, even the ones that we consider to be social emotional, are still relatively logical jobs. Now, we introduce the third machine age. And the third machine age effectively says that we can introduce, like AI gets, everyone says lots of stuff about AI. But if we really break it down to its component parts, right, there's three component parts. There's data that we can have hardware to receive, to provide, to share, to transmit, right? Then we have process automation. Someone who maybe would have had two systems that don't speak to each other, a clinical system, etc., would have taken this, moved it into this place. Like if you go and speak to the average service in the NHS, keeping this within the realm of health care, right? Like they go, we don't have enough admin. There's too much admin. There's lots of people who are filling gaps between things and doing manually. But people's jobs at the moment can wholly be literally in taking things from A to B in some kind of way, shape or form. And on top of that, there'll be a decision. Pathways, for example. BNFs, for example. We think about some of the things where we have decision-making tools. Arguably, intelligent automation can say, as we're seeing is the explosion of AI, can start to come up with very convincing solutions. I think some of your posts recently around like how convincing we are on mental health and the role that this fits in mental health and what these things are. Like, we can logically synthesize and construct emotional sounding and feeling things, which is still based on logic, right? So the revolution, as is argued for what comes in the future, is one where we in society shift from those where they're valued for their logical skills. And, this is going to take place over a long period, hopefully, not a crazily short period, to people who are valued for their creativity, for their collaboration, for their empathy, for all of those things that make up the human system, And so, all you've got to do is look at, for example, what the World Economic Forum says. If you they've got, every year they do like a chart about what the most valued job things are. And if you go back 10 years, it's all very analytical stuff. If you go for this one, it's collaboration and creativity. This is happening right now. And I think the final point that suggests, I suppose, we're seeing this at the moment is if you go and look at any public sector organization, including healthcare, and you look at what the turnover of people who are under the age of, let's say, 35, right? And, I think this has been quite poignant with the military as well. Like people come in, they live in this world where everyone is social emotionalizing all over each other on social media and LinkedIn. And, everyone's a creator and they're starting these businesses and doing all of this kind of stuff, which is amazing to do. And they go into an institution, which is logical as hell, right? It's all about logic and it's all about breaking things down to its component parts. And so I think, as an industrial revolution, I suppose, and maybe we'll come on to this, I don't know, but actually what we're seeing is that we're getting a death by 1,000 cuts as it stands at the moment, in that the workforce is going. And like, I've got to ask you, James, actually, over the last year, how many trainee and recently qualified doctors have contacted you and said, I really don't like this. I'd like a career outside the NHS. I feel it doesn't fit my values. Like how many, right?
In the last year?
In the last year, months? For example, yeah. Don't expect an exact number,
50?
Right? Yeah. Me, like low, like I assume you get 50, a lot more than me. 50 is
probably a bit conservative, but yeah, I'd say it's
I feel I get a handful a month.
One a week.
Small handful. Yeah.
Easy.
It's crazy.
Yeah, it's wild. Well, there's a concept here which I think is beautiful, actually, which is the the increase in value of creativity and what this might mean for our society and what it might mean for healthcare. Now, one thing that I've always found fascinating, I've always been creative, right? I think that's come out very recently in what I do with SomX, with the branding and design side of things, the graphic design side of things, the videography, the photography.
I think it's fair to say you're creative. Yeah, James.
Yeah. And do you know what? There's a guy called Aman Gupta who's at Pfizer, who I was at an event one day and he actually just described me as a creative to me and to someone else we were in conversation with. And it was the very first time I'd ever heard that in my life. And I was over the age of 30 and I was like, hold on a minute, you just blown my mind. Like you see me as a creative. He's like, yes, of course. You've always been a creative. And literally that changed everything for me, that I started to lean into it. And I was like, oh my God, I'm so much happier. This is amazing. But yeah, it's interesting to me that like when you look at something even like architecture, right? You walk around London and you look at how creativity was valued in the past, how sculpture, how art, how the external impression that you can make with your building is a sense of pride and a sense of all these things. There was value to it. There was so much value to that in architecture that disappeared into a world of efficiency, and it was all just about, can you run an efficient building? It's a square block, it's made of glass, and like people go in there and they do things efficiently and all these different things. As a sort of a metaphor for like everything else in society, the fact that creativity got devalued and efficiency got so much valued. Now, when you bring something like AI in that can actually increase the I guess, efficiency to a point of, well, actually, now we can start valuing creativity again. That excites the hell out of me. Like it really does. And pushing that metaphor into healthcare, getting to a point where we can actually turn back in now and go, well, actually, the value of a family doctor that has the continuity across everyone, if we can actually give that person, that doctor, now the time back to care about that stuff and introduce some sort of competitive nature to allow the receiver of healthcare to make choice, we might then start valuing creativity to a point where it's a competitive advantage to have that creativity, in the same way that it might be a competitive advantage one day to have a building that is beautiful because people will choose to go in there a bit more, choose to have their event in there or whatever it is. And I love the thought of that. And you're right, the posts that I've been doing recently about, should we be, just because AI can be everywhere, should it? You articulated it quite well when you said that AI is emotion, but it's emotion based on logic. And it's right. I've described it as a synthetic form of cognitive empathy, which is one type of empathy, the ability to, reflect and push back on someone like, yeah, that sucks. Yeah. Like, it doesn't actually feel like it sucks.
It tastes like truffle oil, but it's not truffle oil.
Yeah, exactly. But it excites me that these things are coming in, just not everywhere. And I think those are the areas where we should, be protecting for, let's leave the human touch in there. But again, accepting of the fact that it can do a job. And my latest thinking is, let's actually be really specific about where it can do those things.
Yeah.
But again, zooming out a little bit, broad brushstrokes, I think it is still too broadly allow the humanity back in and allow a lot more of that human touch back in. And I saw it on someone's tagline the other day that, I believe in AI because I believe in the human touch back in healthcare, or some version similar. And I think that is a paradigm that's coming in more. And I think, you talking about what is the next paradigm of care that you're doing with the Health Foundation, all those things, enriching your soul. I think that enrichment of your soul is because I said this the other day. I think this is important, and I can't quite figure out why. I can't quite put my finger on why, but I think this is a really, really, really important question and point in time where we need to actually define what is the version of healthcare that we actually want to see, and let's now point everything at that. Let's let that police the little decisions about, okay, should AI be here? Should it be there? Should we focus on it here? Should we focus on it there? But all with a view, in my opinion, to increase the value of creativity back into healthcare in some way, or at least some version of that. And I guess the version is humanity and empathy and care up from human to human, I guess.
Yeah, can I pick up on your points on this? Because I think you used a really your metaphor, I suppose, around buildings and so on is the description of a renaissance, right? And maybe we should be envisaging a renaissance in healthcare, right? Because if we look at it, right, the NHS is a national sickness service, right? What we do is people go through and eventually then they get put on a pathway, they get put on a logical framework, right? And of course, I'm breaking this down to a slightly crude, to a cruder element, but so forgive me. But we go and we put people on a pathway and then the reality is that they decline, right? And I think there's I don't know if you ever come across the work of Hilary Cottam in Radical Health, but there's a really fantastic book. And when I was working with the Health Foundation a couple of years ago around what is the next paradigm of care, there were two areas that we looked at, right, which broke into a number of subcomponents, which actually looked at relational care. And so by relational, what we mean is treating someone like a human, not being over prescriptive, having a two-way relationship with them, understanding their whole requirements, looking at all of this different stuff, right? And then the other one, I suppose, is proactivity. Proactivity, making sure that we're trying to stop something happening before before it happens. And obviously, Patricia Hewitt came out and called for this, and we've had people who've been calling for decades around being more proactive and stopping this lifestyle disease crisis. Like the climate change of our health age coming and then just hitting us, which is right, and it's going to get worse and worse. And so I think if we going back to Radical Health, what she did, it boiled down some experiments that sort of, I don't think she necessarily used the terminology of sort of social emotional, but what she did is she found that there were people who were working with different silos, and all of those different silos were doing the thing that was prescribed in that silo, and they were doing it to the letter of what was being prescribed. And that person became disenfranchised, the outcomes got worse, and actually conversely, they required a huge amount of time and cost for the police, for social services, if we take those who are most marginalised in the community, right? And so what they did is they had this experiment with these who collaborated together, these different groups. And what they did is they empowered it and gave them a budget and said, help us help you to solve it, right? And I think there's a really powerful message in this. You as humans are the ones who should have the agency to be able to define what your future is. And all of this is collaboration. It's being creative. It's co-creativity, not just creativity. We don't just do creativity to people, but we do creativity with people and engage their creativity. And as a result, the outcomes for these things were unsurprisingly excellent. And so I suppose, within this view of the next paradigm of care is one where if we want to prevent things happening, if we want people to not just inevitably go into the system and actually do prevention, let's be honest, the best outcome for any doctor, for any physio, for any nurse, for any AHP is never having to see that person in the first place, right? Always. And so if we think about this renaissance, this emotional revolution, and I don't know if you ever read the Health Education England Top Hole review that came out in early 2019, but
I did.
There's some beautiful vision in that of these physios or nurses who are like hackers, and they're in their community and they're doing all of this different stuff, and there's technology there, but a lot of the vision goes into what the future of the workforce is. That seems to me like a real renaissance in the healthcare, right? And that we can create the capacity. But when I look at the current system, there is a deathly silence of that emerging and coming through. Deathly silence. I would argue we're going in the other direction, and that technology is becoming the end and not the means.
One thing you said to me previously was that the tech revolution should be a moral revolution. What do you mean by that?
So I've been really going down a rabbit hole recently about revolutions, right? I've been reading a lot of stuff around revolution, right?
Are you okay, etc.?
Yeah. Maybe it's because it's election period, right? But, and I've been staring at this stale, disappointing whole, missed opportunity to have proper discussion and debate as a society about what we actually want, and feeling a degree of despair. Actually, yesterday, someone checked in with me and said, I just need to check, are you professionally despaired or do you need help? And I was like, I'm professionally despaired. I'm actually great. Everything's great. Life's really good, right? But
what a lovely check-in, by the way.
It was really nice.
Very nice. Knowing that you actually care about this stuff to a point where it could affect you. I think that is worth noting. That's a lovely,
I'm angry.
Lovely
I'm
question
furious,
to ask someone.
And I'm upset about the way things are. And to be honest, some days I just feel it bubbling in me, and I get my camera on and I put it out into the world because I think that's what we need, and maybe that's appropriate or not appropriate. I don't know. I don't make it about me. I make it about what I think is our missed opportunity. But in terms of the moral revolution, like, a moral revolution is, I've just been reading a book by a philosopher actually around how moral revolutions happen and what the dynamics are. Because I want to know, how do we get there? How do we proactively get to a better system? What
do you mean by a moral revolution first?
So by a moral revolution, what we mean is there is something which is considered to be the done thing, such as slavery, foot binding in China, many of the other things that we've now looked back as ills of society, some of which are like huge, and some of which are things where we shift a paradigm and we look back and say, did we really do that? Like, actually, if we take, if you watch Mad Men and like look at the relationship between a man and a woman in the household, or actually if I look at what the relationship was between my mum and dad, and think, we had this at the time. That wasn't considered to be immoral. It was the done thing. And yet actually, we're having, hopefully, and we hope we keep having, a moral revolution that really gets us to a point of equality, genuine equality, embedded, natural, where we don't have to be pointing at stuff all of the time. Okay, like that's what we all want, right? So as part of a moral revolution within this, like the moral revolution that I'm really focusing on is right now, we have people who have a relationship with. So if we take, for example, what Yuval Noah Harari said in The End of Sapiens, and what he said is that the religion of society has kind of moved to a point, of course, people still have their other religions in some cases, but where we've basically traded the community for capital, and we've exchanged, the social fabric for the state. And so we now live in a place where what we've done is we've gone, the state will come up, it will create all these departments, and it will give us all of this different stuff, right? And that this is playing out right now, right? We've got a system where we ask why the system isn't fixing us, but we're not asking why we and our community around us can't help to live better lives. Like we've given away. So I'm reading a very left book at the moment, actually, which is called Limits to Medicine by a guy called Ivan Illich, which is like medical nemesis, the expropriation of medicine. And he's very far to the left, right? But what he says is that we've created an industry that has changed the definition of health, right? And so the definition of health in this is the previous definition of health is that we are organically connected to our own community. We have agency and ownership of our life, and our health is our own. Whereas I think, in the system, sometimes we go, I've got this thing, fix me. I want you to make me better because I pay my taxes. And we see it in the election at the moment, right? I pay my taxes, so you should heal me. We're all in our own organic bodies, right? So I suppose going back to this moral evolution, I think there's a few areas where I think that this could emerge for the system. So the first one is that we start to see that, I'll try and put this sensitively, that the way that we deliver healthcare at the moment, the mechanistic way that we deliver healthcare, hopefully comes to become something that we look back on and say, wow, like people used to come in, they used to get treated for all different things differently. They're on a conveyor belt. They got all of these different things. They had loads of polypharmacy. They were rattling because they were taking 10 medicines. They had contraindications and all kinds of side effects and symptoms. And they were just on this conveyor belt of being failed by a system. Whereas hopefully that's one of the elements in a society. I think the other bigger one for me, and I think this is where I focus a lot of my attention, is we've never needed to innovate more. We've never needed social emotional skills in order to creativity and ideas in a system, right? And yet the average person in the workplace is disengaged. A high proportion are actively disengaged in the workplace, right? If you go to the average member of staff in the NHS, they feel that they're just on a hamster wheel, they're exhausted, like frontline, back office, everybody's knackered, they're tired, and realistically, they are not being seen and utilized for their full human potential. And so I think that a positive vision in duality for this is we look to empower staff to be the best possible versions of themselves. By that, we focus on and prioritize their social emotional value to the NHS and not their moving things from A to B and logical. And I think if the focus on technology is that, then that could be the ingredients to really drive a fascinating moral revolution, which is positive and that doesn't mean everyone leaves until the system gets into absolute chaos. Although someone yesterday said, like, oh, we're already not there. that actually helps us to re-emerge with a different system, with AI being prioritized, AI technology, process automation, all these different things in the right kind of way. And so I wonder whether there is the renaissance we could see is a renaissance for the person who's working in the system of healthcare in a way that's connected to the community, and the individual who's the recipient of it. So I think that there are arguably two moral revolutions. But when we look at where we are, my question that I can't answer is, how do we provoke that? How do we make that happen? And I don't have the answer to that. That's my ongoing hypothesis.
Yeah, because the thing that came to mind for me is, how's that going to be measured, and how is, again, because the election's on, how is a health secretary going to be able to turn around and go, it's now better because tech and AI came in, we freed the workforce up of their administrative burden, we cared more about the social and emotional side of their job. They then cared more about the social and emotion side of the patient care. The patient care got better in some metrics. And then how do we then prove that? The first question, though, would be how do we even set that in motion? And I guess that in part comes back to the question that I've been asking recently, which, and again, these things have no answers, but two people with no answers doing a podcast, what an amazing conversation.
Hey, maybe we need two people with lots of questions but no answers. Maybe we need people with less ignorant answers and more questions, right? Maybe that's the thing.
Yes, I think
need,
so.
Right?
Yeah, he just comes along super confidently, answers these. But yeah, I think that just comes back to what I've been saying recently, which is that I don't think we've actually as a community decided that this is actually what we want. Have we literally said that as a healthcare community, what we're aiming for with technology and the AI that can come in and solve so many problems, have we actually said that what we want to now do is move the workforce from a place of administrative burden, diagnosing, deciding what the best treatments are by differential diagnosis potential in order of percentage, and like all these cognitive things that we've been doing for so long and that AI can now do? Have we actually said we want to move to a place where we're shifting this more to AI? We want to put the care back into healthcare. We want to free up people to do that. Or is it what Keith Grimes has been saying, which is that AI is going to come in and do a job in the current framework. It's going to free people up in the current framework. The current framework is going to stay the same. And we're going to go, oh, you're seeing people twice as fast? Well, here's twice as many patients. And then we're back to square one.
Yeah.
And that's a huge concern, that you're absolutely right. Without a sort of a change in the entire system. And actually, in fact, I spoke to someone from Deloitte on the podcast not that long ago at all about this, which is that we can't, she's very clear actually that we can't be aiming for AI to come into the current system and just be better at everything the way it is now. She actually went a stage further to say that we shouldn't even redesign the system around what AI can do. We should just think about what the best system is. And I think that's what you were saying at the start of this conversation, which is that we might actually turn around and go, oh goodness, I can't believe that we even structured healthcare in this way at all. And I think that's a super interesting question, because I fall into the trap of thinking, well, what if we redesign the system around AI? What could it do? And then I go like co-pilots and ambient listening and, like help with diagnosis and all these things. But then actually you might go, no, that's even too reductive. Yeah. What should healthcare actually be in totality? If we were to just redesign everything from scratch, imagining anything was possible. Yeah. But then I struggle, because as I say that right now, I'm thinking, oh my God, people are turning this podcast off because now he's just lost the plot. Now he's just gone into fanciful world. And that's even if they made it this far. He's gone into some fanciful world. They've gone so high level, using words like high level, that all of a sudden now this has just gone into the ether of just nonsense. So I don't know how to keep my floor on the ground and keep this practical. But I do still feel like there needs to be a vision around, someone should come out and say, what if healthcare was like this? This is something to aim at.
Yeah, absolutely. So I think this is something, that I've been, trying to delve in with my experiments. Because actually, let me bring this down to the micro, right? Because macro then micro. So in the bigger picture, I think we have a choice in society. We technologize autocracy, or we digitize empowerment, right? for those around us.
Okay, yeah.
Okay.
Autocracy meaning top-down.
Autocracy, bureaucracy.
You do what I say.
The view of a controlling system, right?
Right.
Versus the view of an empowering system, sort of bottom up versus top down, right? So there's a quote that I find myself using all the time, I suppose, within this, which is the master's tools will never dismantle the master's house, right? And I guess at the moment, so in the military, I've been working with quite a lot of people to, I suppose, talk about the mechanics of new power and how that might be the change in the system. Because actually there is a change coming in the system. Because I think people in the system, I think if you could properly poll most people in the system in the right kind of way, I would say the vast majority of people desperately want something to be different, and they want it to be more human, and they want it to be more caring, and they want it to be more relational, right? But don't know how we do this. So let me take this down to a micro, right? As you know, I work with individual teams and services. I go right down to detail because I think you've got to see it all the way from the top to the bottom. And quite often people will go, oh, right, we want to use this tool and we've got this convoluted sort of process that does this, that, and the other, and we want to do this. And I'll sit them and I'll go, why? And they'll go, well, because once someone made a mistake and we did this, and then, we ended up having to protect ourselves and stuff like that. And they created all this bureaucracy around this thing, right? And I was like, could there be a conversation about trust? Could there be a way that this could be done more explicitly? And they're like, well, we suppose. And I go like, try and have that conversation. Then they'll come back and they'll go, all right, okay, so we actually had a conversation. We've worked out a much more lightweight thing to do. We don't have to over-technologize it, and we can make something different. I think there are things that need to happen in order at a micro level to change this, which is one, we need to prioritize creation tools in the NHS, right? If you take most of the piece of technology that are being prioritized nationally, ICB level and so on, it's people filling in boxes. It's Newtonian. It's people being prompt to do something. I went back to that GP before, right? Those different activities they have to do, right? Generally, it's doing one of those better, as you say, right? Now, if we only prioritize technology that gets people to logically fulfill things, then we never give them an experience and a chance to be able to see it's possible. And I suppose the work that I've done with organization systems is my best work I've ever done has been when I have helped to hold a space for a team, to help give them some information and possibility, to try and help them see that this is their agency. And then they come back 3 weeks later, I hear nothing from them. They go, you won't believe what we've done. And that's my fact. That is the best thing I've ever done in my career, right? Out of anything. Because these people, a light bulb goes off in their head and they see something different, right? And they've got the tools to be able to improve. At the same time, we've got all these organizations that go, we need more ideas, we need more innovation. And then they stifle it and then they complain there's no innovation and nothing changes. Or they have lots of failed projects because they've over-solutionized, or they've tried to find a hammer without a nail. And so I think materially in our organizations, like when for my sins, I designed and taught a 100-hour course on how to be able to think differently this. And I delivered it in 2021 to about 20 people working in the NHS. It was supposed to be like a really close, intimate course. And, a lot of this was about just trying to undo some of the things that we've done. I think we can do a lot more with a lot less. But as you inferred, I think we need to have a discussion on moral framework around what is this thing that we want to be able to bring. So it can trickle down and we can find experiences that gives people the knowledge and the ability to do that can then cluster together and form this revolution. Because there's two ways that revolutions happen. One, someone powerful enough comes in and changes it. The other one is it's people, it's collectives, it's collectivizing and growth. And so I guess the question around how Wes Streeting measures it, sorry if it sounds like a critical point, but it's a logical question. Right? I know voters maybe not be voting, but how do we measure and monitor all of these different things? It's very much about someone in the top of a top system who's measuring and monitoring something. And I wonder whether there is a parallel devolution question around how and whether more empowered local communities could measure that in a different way to the current system that we've got. Sorry, I'm giving you hugely long answers to these questions, right?
It's interesting to me that the more power gets closer to the ground, there are lots and lots and lots of different examples where if power gets closer and closer and closer to the people for whom that power affects, the decision making can often get much better. And yes, people can feel, of course, more empowered, but actually the decisions actually are far more reflective of that community. So yes, moving power closer to the ground can definitely do that. One example of this that I want to talk about, this might be a little bit tenuous, but when I think of individual patients going through the system, right, we talk about the postcode lottery. And trust me, stick with me on this. This does relate, and I'm trying to make this practical. So we talk about a postcode lottery. What your postcode is, just is what it is. You now have the ability to access whatever healthcare is just in your postcode. That just is what it is. So for those organizations that support people in that postcode, if they do it well, great. If they don't do it well, great. Because they still get the people going through the door, they still get the revenue. There's no real problem. One interesting concept that comes to mind to me, and you'll know more about the business models around this and whether it's possible or what the negatives are. But one thing that I've wanted to ask you about is, what if you gave individual patients more choice about where they accessed care and they had the ability to change? And I know there's some examples of this, like when you get outpatient appointments and things, but I'm talking like a bit more definitively of giving the people the choice. Because my hypothesis is, for those organizations that prioritize the social and emotional, the patient experience, people would vote with their feet. They would just access places differently. And the organizations that weren't so good at it would get less revenue and fade away. The clinicians that were good at it would be hired by those for whom it was a priority. You would start to get sort of, I guess, like market dynamics occurring where things would start to change. And actually, I don't know whether that pushes us more towards a US system that favors the shiny, and actually new technology is brought in for the right and the wrong reasons. I don't know. But like, I'm interested in this as a concept, and I'm interested what you think. I'm also interested what the downsides of this would be.
So let's start with converse and then go to, so, I think you're absolutely right around the postcode lottery side of things, firstly. And I think, I'm aware that we're not on Pigeon, we're on the Healthtech Podcast, right? But if we're going to bring this into current affairs, right? Debt relief for ICBs at the moment, right? So take two polar systems, right? We have Telford and Wrekin, right? Recently on Dispatches the other day, CQC is discussing a documentary about people being treated in corridors, like so inhumane that they're having to now respond and say, oh my God, right? Also, the highest failing ICB in the country in level 4 measures, so highest level of intervention by NHS England, and also highest proportion of debt that was passed on from when they were CCGs to this area, which is 36%, I believe, of their overall operating spend. So they have a third debt for their operating spend, right? Now, let's hold them, right? Struggling as a system. Let's go to Cambridge St Peter at ICB, right? Now, they are one of the better performing systems. They have a big university. They've got a cracking hospital that draws in loads of revenue because it's Cambridge. They've got a really good system. They've got a relatively affluent and healthy population. Peterborough less so, but Cambridgeshire absolutely, right? And they have just met 2 of their financial targets, right? And what that has meant is, because they've met their targets, they've had their debt relief taken away. Now, better performing system suddenly has their debt relieved. Worse performing system starts to have more intervention and special measures, right? So I think if we're to look at this postcode lottery, right, and to take what we've got at the moment, there's an argument at the moment that we're making failing systems fail more and we're making succeeding systems. Now, this has always been an economic thing. So there has always been an optimal model. And I think part of the reason that's been suggested is because Telford and Wrekin wasn't the ideal size. And generally, NHS England tries to economically favour what they think their ideal model is, which is me getting into too much geekery. So I'll sort of bring it back because I'm thinking about your audience and the fact they're like, don't care, Liam. But I think the reality of this is, as you say, if I live next to Telford and Wrekin Hospital, I have no choice. I have no agency. I have no change. Like Sarah Wollaston recently leaving her role because another lot 4 level system, intervention. She couldn't consciously make the choices. The people in that system have zero choice. The only choice they have is to go and move somewhere else, which may be good for people like me and you, But for the average person who is living in a cost of living crisis has absolutely no choice about whether they have terrible care or good care. So fundamentally based on this, right, I can't agree with you more that, like, you know, and then we have an election where the party that's going to come in isn't really telling us anything. We don't know what's going to happen. And there's no real choice in the election between a two-party system. And so we got this other element, right? So I'm a person who said, well, you've got a choice, you can vote. I don't really know what I'm choosing, right? And so if we look at the individual who lives in Telford or Shrewsbury, who lives in, I don't know, sort of Woolacombe in Devon, I have no choice. I have no agency. I have no empowerment. I've also just told bits and bobs, you know, like infantilized headline targets about this, that, and the other. And I don't know how to navigate it. So, and this leads me to the actually answering your question, right? Because I think, firstly, how do we build empowered people? We build empowered communities. How do we build empowered communities? We empower communities. We can't just go and be empowered. You know, it's kind of like the Monty Python sketch. You know, you will be more individual, and they all repeat, we will be more individual. Like, we can't get that unless we make it tangible. And, you know, I think there's certain movements and things like where, like, for example, the defund the police movement in the US, right? What they're saying is we have interventionist police, invest in our communities and we will invest in better things, right? And so I think there is a choice, but I'm not sure, I think there is a desperate need locally and in communities for choice. I guess market dynamics, I suppose, like, what about if we create market dynamics and have the same bland vanilla services? I'm not saying services are all bland and vanilla, but we have the same kind of, you know, it's basically whatever flavor is vanilla. Then realistically, do market dynamics really change anything if effectively we still have this top-down model with economic points and stuff like that? So I think, in principle, I love the idea that services can experiment, they can prove their experiments, they can do different things, they can use different kinds of technology to try and make that happen. They can do lots of different things, but it's not just about empowering the person, it has to empower the organization. And that creates like a train that goes up to the top of the system where you've got a health secretary who's saying, I'm going to do this, I'm going to deliver that, we're going to create this is the target, this is what we're going to see. And one of the biggest points that I always say around this is that there's cultural dichotomies that exist, right? We can't have our cake and eat it. We can't have the existing thing and the better thing, right? So I think this potential change in systemic change that hopefully we may get for the better, it's not adding a few bits on, it's a root and branch change if we actually want that. And so my answer, my hugely long answer to your question, James, is yes, but if we just did that, it would fail, and then we'd have lots of people pointing it like it failed because we didn't change anything else.
Now, here's a difficult statement now, because you go the logistician in me, if that's what you call someone who operates on logic, but that person in me then extends the argument, and then when I step back and I analyze where I've just taken my own argument in my head, I go, how am I now just thinking about all the benefits of just privatizing the whole thing? And that's a very concerning thing to be thinking, because then by giving the organizations total agency, giving the people total agency, all of a sudden you're now going, well, actually, or are you just freeing them, keeping them within a current public system, but freeing them to sort of act in a certain way? Like, I don't know. I guess, is this a dangerous route to be going down with this argument?
I don't think freedom is necessarily capital. There's a guy called John Alexander who's written a book that I'm halfway through and need to finish, which basically sort of says is that actually, you know, and we go back to Yuval Noah Harari, right? Our religion became capital. Everything has an inherent financial value, whether it's childcare, whatever that might be, right? And the state, the all benevolent state, right? And I think these are the two paradigms that I think we're coming back to, because I think people are desperate. Like, what's the new cancer? Loneliness. Right? People are desperately on their own and disconnected from communities. People don't have the support structure. I'm going to say, actually, as an educated person in the health system, a couple of months ago, I felt like an absolute, I won't swear, but an absolute hypocrite, because I did my NHS health check and I'm heading up in the weight zone, and I was not really, you know, kids, family, bad habits, COVID pandemic and so on. And I had this moment, and like, I've quit booze, all refined sugar, ultra processed foods, going to the gym, I'm paddleboarding, I'm doing lots and lots of stuff, and it's fine. I'm managing to deal with it. But I had a period where I looked at around me and I was like, I just looked at the app and I saw this, the NHS app, and I saw some number and I didn't like that number. And I was like, I wasn't in a risk factor, but my next step would be in a risk factor. And I thought, there's no infrastructure around me. So I guess if we think about what we want to achieve in the system, like what we know is that the private system, financially, they're finding it very economically difficult to drive prevention.
Yeah.
Theoretically, but actually, if we look at the private system, like there is no example I can see where a private system is nailing it. So it comes back to, all right, if it's not state system, which is struggling, if it's not private system, what is it? And I find this tier in the community, in this between, where, and this is where a lot of my work is going, I suppose, arm's length bodies, is the community. Like, there's a guy called Cormac Russell who's got the ABCD method, which is the asset-based community development method, right? And it's all about looking out of your window and the people on your street, building relationships with them and saying, how can you help each other? How can we do things? Because as far as I see, we have a huge amount of social capital that we've destroyed because we have no links in our communities. And I wonder whether if we take some of the most difficult manifestations that we have, you've got no listeners on this podcast left right now. It's getting so like high level. But if we take this,
I'm really enjoying it, Liam. So I'm fine with it.
That's right. It's for us. We're the listeners, right? I'll listen to you. You listen to me, right? But like, if we take that and we say, all right, what about if we need to start thinking about social capital, right? We need to start thinking about the social capital that we have, the community capital that we have, the ways that we can build links and support each other and not feel so desperately lonely. Like, it's no surprise that loneliness is the biggest thing and mental health is rocketing, right? Like, many of us have moved away from our parents. We come into the world and have kids, and there's no one to support us. And, we're wandering around on our own. And I'm very lucky that we've moved into a street where everyone is wonderful. Like, we just do so much stuff together. And I have to say, I love it. I love it so much. And everyone's helping each other. I feel I want to contribute. And I feel that there is so much that many of us in our sort of urban and suburban lives have lost. And so for me, my heart, so you've obviously taken this logically, but my heart says that we need to rebuild communities. What we need to do is we need to take what Yuval Noah Harari said, and we need to start reconsidering, is the benevolent state actually the benevolent state? Is it the thing that we, I'm sounding like a socialist revolutionary here, but like or is there something better? Like, that we can locally, that needs to be more empowered and have more accountability. And actually capital, if it's not the state, like, it's interesting. It's the state and capital. So we go, well, if it's not the state, it has to be money. It has to be a private system. And it's interesting. These two, it's like, well, it's not that religion. It's this religion. But I feel that there's so much more that's kind of been disintegrated into our conversation. And, but again, that's about this moral framework. If we empowered communities, could we massively take a dent off prevention? I feel certain that we could. I feel absolutely certain we could.
And there's this space, isn't it, that no one's ever managed to define very well at all, and certainly not to lead. And it's somewhere between, conscious capitalism and socialism, because what you're talking about there is almost like communism versus, the extremes of capitalism, fascism, and actually, like, where the heck is like the leader that comes out in the middle of there and actually talks about, like, as I say, either conscious capitalism or socialism or whatever's just slightly in between those two. Outside my house, out the front of my house, on the road, there are some weeds growing, and they've grown like hilariously large at this point. And I keep thinking, like, the council will come around at some point and sort that out. Like, they haven't in quite a long time. And it's interesting to me because I walked past me the other day and said to Jess, like, am I allowed to just like get rid of those? Am I allowed to just like get the strimmer out and just get rid of it? Because I've got the strimmer out on the lawn, which is like 2 centimeters from there. Am I allowed to just like take that out and like do that? Because like, I'm not actually sure. Like, I don't know. Is someone going to have a go at me for doing that? Like, I don't know whether I'm in this like state that's going to like shout at me for interfering, or whether I'm in a state which actually would reward me for doing it. But like, there's also the other thing of like, am I allowed to do it? Or like, I expect expect them to come and do it because I pay my taxes, and I'm not going to do that because I pay my taxes, and like all this sort of stuff. And like, I'm going to draw a parallel here with like, again, preventative health and like, you know, advocating for my own health and doing things for myself in that of like, yeah, part of me is like, you know, if I have this thing that go wrong, it's like, yeah, I pay my taxes, the NHS should sort this out. But also, like, is there not responsibility on me to like sort my own health out? I guess the plot twist with what you've been saying about community is that actually, by me just getting the strimmer out and sorting the weeds out, everyone on the street benefits. And also, I've also enjoyed that. Yeah. But I've also enjoyed that. I've also enjoyed a process where I've like done something for community. I get to feel good about that. I get to do that. And I think one of the problems that we've got with this is someone else's problem mentality, especially as it pertains to healthcare, is that we're suffering on multiple counts. We're suffering on the count that we're not getting the problem solved because we expect someone to solve it. We're suffering because we are not just spending that time advocating for ourselves because there's joy in that and actually doing the thing, the eating healthy, the exercise, all those things. Now, I accept in here that there is a wealth gap argument of like, you know, there's the people that can afford that stuff and the people that can't or whatever. And I'm sure people can make that argument very easily. And I think we're talking in broad enough brushstrokes here about like, we're actually just trying to set direction here of what do we want. But you're right. I think the emergence of community in the middle and actually allowing someone like me to go, you want to do something for the benefit of the whole road? You go for it. Like, why not? Like, just go for it. That empowers me to do it, so I know that I can. But also, I've enjoyed it, and there's joy in it, and yes, it makes me healthier and all these other things. But yeah, how do we build a business? I was going to say how do we build a business model towards it? But like, how do we set? How would we set up healthcare in such a way? Or how do we set direction, or how do we set policy in such a way that would achieve that people build technology, people start health tech startups with a view to restoring community? Because like, people are even struggling to start health tech startups with a view to improving the state of play for clinicians on the ground floor, because there's not really a business model in it. Like, you improve the lives of clinicians, well, they ain't going to pay you for it. Like, the system's not going to pay you for it particularly. Like, it's really difficult to even do that, let alone like restore a model where people are looking after themselves and these different things. Actually, before I finish on it, the one business model that I have actually seen on this is social media, because actually clinicians are now starting to gather massive followings by basically being the new Public Health England. Like, they're literally doing videos on what a squamous cell carcinoma looks like, and they're getting loads of messages saying, well, thank you for that video, because 1,000 of us have now seen that video and we've gone and got it checked out, and we've got an SCC removal next week. And like, those individual creators are actually business model positive themselves just within a social media model, because actually YouTube's just paying them revenue for sticking the video on because it's so engaging. So there is actually a business model there, which is interesting. And that very much is health tech that I'm allowed to talk about on this podcast. So like, is that the future, Liam? Are we all now just putting our hopes in healthcare creators, or is there a way of setting policy that actually fosters everything that we're talking about? Is there a win-win here?
Like, you know, like even the Patricia Hewitt review last year, which I largely agreed with a lot of it, apart from NHSing a entire team, so it was a terrible idea, but that's beside the by. Which they're doing, one of the suggestions was like, we need to ring fence money in the NHS for prevention. And I get that. I get it, right? But is that some conclusion of prevention? Right? Because where is we need to give money to local communities with challenges? Like, there's I started reading there's a philosopher who sort of talks about how effectively that nationalism is the problem. The new model is that we need local empowered communities to solve local challenges and with a global mindset. You know, the sort of like, you take like the donut model, right? You know, like if you take, that we create a new thing that people in communities have to try and solve at the same time. And I think the donut model by Kate Raworth in Donut Economics is a really interesting one, because actually it changes the perspective of, it takes it away from capital and turns it around into social mission as well, and tries to hold the two, because capital isn't giving it, like, it's not solving our global or our local problems as far as I can see it. So I think, to me, like, we have the same problem that a lot of our technology is institutional rather than facilitative, right? What I would love to see, and I spent quite a lot of time thinking about this when I was working with the Health Foundation. I'm still doing Health Foundation projects with local areas, and so, like, one of the projects is very much around how can technology empower, like, the VCSE sector, carers associations, to be able to play a bigger part, so it can work in tandem with a system, not for the system, but push up and be able to advocate with and in collaboration with the system. And, like, that's a thought project that I'm kind of working through at the moment and trying to find some of the answers. But I guess, like, as you say, social media, right? Like, we have social media, which is based on the agenda of large technology companies. Yes, there's some really good things that are coming through, but there's also some ills as well, right? If you've seen Social Dilemma, then absolutely. It's fair to say that it's not the community infrastructure we necessarily would have wished for.
Well, and there's bad actors and misinformation and all the rest of it. It's just not
exactly,
just even,
which we're seeing loads. Yeah, we're all being pushed to the left and the right through rabbit holing. But I suppose, like, the thing that, right, what is NHS England really, really bad at, right? Prioritizing creating technology that allows people to share and collaborate with each other. Right now, if you're doing anything innovative in Devon, nobody in Newcastle is going to hear about it unless they happen to be going to an event, and not everyone's going to events all the times, right? NHS Futures is it's really difficult, it's outdated, right? Well, like, where is the social media? So I think if we're thinking about local communities, there's an organisation called Bertzorg. I don't know if you've come across Bertzorg in the Netherlands. They're a community health provider, and what they have is a number of self-managing teams. The CEO's job is not to tell people what to do, it's to take ideas and facilitate. And for me, I think that the infrastructure of this is a facilitative infrastructure, right, that can help people share good ideas, and there are things like this, for example, Q by the Health Foundation. I think Peer's trying to build some stuff as well in that area. But like, realistically, I think if we want to technology that empowers people, we need technology that facilitates good practice rather than forcing it down. You have to do this because some national body saw that you've got to do it, right? And I think the other element, and, like, I always get shot down on this, but I think that there's a lot in the DAO model in blockchain, decentralized autonomous organizations where you can actually give votes and credits in order to functionally underpin forms of democracy, better self-managing organizations, better decision-making, and so on. And so I think there's three technologies which give indication around how we could allow this to happen better, because the argument has always been that we've never been able to have communities that have been fully functional because they're so disparate and fragmented from each other. So for me, I would be putting my energy and effort and money into the technology that builds a technologically enabled, empowering social fabric. And so if we had that, that's what I would like to see. And so in organizations, when I'm working with them, we try and imagine what Microsoft Teams can be, because actually, if it's imagined in the right way, it's a technologically empowering social fabric with creation tools that people can use. And I think that there are models that we can take to enable this. It requires huge change. But again, this is something that nationally, locally, I'm not seeing any investment in, really. So I think giving money to the NHS for prevention is going to create more NHS intervention.
Yeah. And again, that comes to that, what do we want? Is that what we want? My question around what you were saying before was going to be who funds it. So you talk about, a technology that brings all of us in healthcare together to share ideas. NHS organisations can explain what's gone well and why, and we can start spreading information that leads to better innovation. Who in your mind funds that? And actually, again, centrally, thinking out loud, centrally funded, the question becomes can that pay back in a 5-year political cycle, I guess, if you push it through in year one? And actually, what's the metric that we report at the end?
Well, yeah, that's the hardest question, isn't it? That is the hardest question. What I would say on this is, I suppose it depends on what it is, on what we're funding. Like, because I think the principle of this is that we need to fund things that create more of a, I don't like using the term workforce, but actually creates a community social workforce. It creates capital in the community, right? So what I would say is is that there are potentially metrics. If you had the right technology and you had metrics for how much people are contributing and engaging and doing stuff and what the increase in is that you can measure it, use the best of technology, which is really good at doing this kind of stuff, right? And instead of saying, all right, what's the exact outcome? Because prevention takes time. You can't monitor prevention always in a cycle, right? And this is the whole problem we have with prevention, because you have to invest, like generally as a principle, you have to invest heavily in prevention for it to happen. But prevention isn't in this 1 year productivity, cash releasing sake. It doesn't work and it doesn't exist, right? So actually, if we're to invest in progression, rather than using prevention, which includes prevention as making things better or not making bad things happen, then you'd need a different set of metrics. Now, realistically, who would pay for this? Well, the taxpayer would have to pay for it in order to create technologized community infrastructure in order to then create that. But I guess if we're thinking, if I was a social VC here, right, and I was thinking, I want to invest in this, right? And, there are social VCs who think about actually, what is the social value that we're creating? I built a social enterprise and ran it for years. I've been on boards of social enterprises. I work very closely with them. I guess if, there's some really good technology out there where people are managing to improve their metrics. There where you can do therapeutic outcome measures on people being more healthy and living healthy, active lifestyles. I'm sure there's metrics around people chopping down the weeds outside the front of their house, right? So, but I guess there are data points that we can get. I guess it's just about what data points we're looking for. And my view is if we could invest £1, to borrow like the health economic model, right, or the just general economic model, if we could invest £1 in for some kind of value, and we could get £10 of people doing things for themselves, if quantified.
Yeah. Okay.
That's a great investment. Like, in the NHS, if you can do a 10-1, that's like golden investment, right? So I think we need to have the same kind of metric. But I guess, and if I'm to be a bit more philosophical and woo in this as well, like a lot of this comes down to metrics. And it's really great to be logically challenged on this, right, James? But at the same time, how do you measure doing the right thing?
Yeah.
Because I think in people's gut, there's a lot which is actually about doing the right thing. Like, what's the cost of loneliness? We've got no plan to solve loneliness anywhere. There is no plan for loneliness. Like, what's the cost of? Well, we arguably know what the cost of diabetes, cardiovascular disease is. It's huge. It's huge. It's like system breakingly huge, right? Is it not worth a punt? Like, given how many billions we spend on treating the top 5 lifestyle conditions, including like spend on SSRIs. I was talking to GP the other day around that. Doesn't fix anything. SSRIs don't fix anything. They just dumb it down a little bit, right? And maybe some will say that it does, but like, there's no real evidence that says it actually improves the mental state of individuals. So we invest in quite a lot of things that don't actually fix the problem, that just keep it manageable. I think there is a huge social return. I did not expect us to be going this deep down the hole, but yeah. But I think there is a huge social return in us just thinking about what's the right thing? How do we measure it? How can we get some metrics that we're doing the right thing? And I think, for example, I'd be interested in further exploring what Kate Raworth's model is, because actually it looks at a lot of these different elements, and the donut model tries to hold capital and social in the same element. All of this comes down to paradigm shift, and it means that we need to start thinking about what is a priority and what do we measure, and do we look at all of this from the temple of the institution and the capital, as Yuval Noah Harari suggested?
Yeah, the biggest argument against the things that I was saying about if we put AI at the point of human suffering, that is now a new baseline that we in healthcare have now accepted is okay. And so if AI is at the point of human suffering alone, I should add, I think that would be a very difficult baseline to come back from. That was my argument based on literature that I'd read and where we are with sort of the requirement of empathy in those situations, and the argument about it really changes the fabric of what healthcare actually is if we become okay with that. The biggest argument against that was actually loneliness. The biggest argument against that was the epidemic of loneliness is at such a scale that if AI can just do something there, then by just blanket saying that AI should never be at the point of human suffering alone, we might be leaving some impact on the table. That was actually genuinely the biggest argument that was said in my DMs after I'd come out and said that stuff. And so I just wonder, like, with everything that we've talked about here, moving to a world where we care more about the social, or we appreciate the value of putting the social in, and it all kind of comes back to the same thing for me, which is that we're at a point where this might actually now be possible with AI and everything that's coming, like everything surrounding it with technology and health tech broadly. We seem to be at a point where, to sort of, put the positive spin on this now, that like this might actually be possible. At the beginning, we were talking about vision, like who sets this vision, like who actually does all these things, and we've talked about local communities and putting devolving power down towards the people for whom it affects. And I think these can all be decisions that are made and can be made. And one half of me is like, we should define all of this, and the other half of me is like, let's just get AI in doing a job and start freeing people up. Again, though, my concern with that is that we free people up to then just do more of the same. We don't actually change the system. And so I think this exploration has got me to this point where, like, I'm definitely more educated on this. I definitely feel like I've got more clarity. But I definitely see, rather than but, I'm going to say I definitely see now why this vision is more important, like why it needs someone to come out and say, this is now the view for healthcare for the future, and this is what we should be aiming for. Can we all please make decisions that aim at this? I think that is needed.
Yeah. Again, master's tools, master's house, right?
Can you explain that a sec?
So the master's tools will never dismantle the master's house, right? So if we go and expect the master of institutionalism to give us anything different than institutionalism, then we're sorely, it was actually written by a Black woman, and it was the whole premise of her book is actually around the other areas of huge discrimination that we still see in society. Obviously, you and Jessica are really sort of, put out there with a big spotlight on it as well, and so on, that we've seen with Diane Abbott and stuff like that. So I think at that time, I was, quietly asking around, what books, what information can I get, trying to improve my part in this. And I was recommended this book. And to be honest, the title and the sentiment of the book in this is very much, we can't expect the dominant prevailing system to give us anything other than what it is. The question is, like, for example, we're talking about sort of major corporations and the increase in inequality and how much major corporations globally are, can we expect that they who now hold and control of the power, I sound like a real revolutionary here, but logically, can we expect that they are going to work outside of their own interest, that they're going to change the system that they benefit from? Of course not, right? And so I guess my approach, and I've done this quite a bit with the military as well, and, is around chartering. So, I'm going to be honest, I'm at a point where, new baby coming along, and I'm thinking about my career. I'm thinking about the things that I read and believe in and trying to do in the NHS. I don't know if I'm going to have any impact on anything we're discussing in my career on this, but it's the thing that I care the most about professionally and will devote my life towards doing, as long as I can pay my mortgage. Family first and then this mission second, right? But what I've seen, and for example, the stuff for the military and so on, is that actually, if we have a group of disenfranchised staff, if we can create opportunities to activate them, to open their eyes, to see it doesn't need to be like this, it can be different. And we can think differently around technology. We can choose to make this about the humanists and the technologists talking together around what we want to see and design something. Then actually there's a huge amount of hope, to stick with your hopeful mentality around this. But I think this needs to be a people revolution, and not just the people in the NHS, because obviously we have a lot of health tech organizations, for example, who are like, we interviewed a load around for the Health Foundation projects, and actually they were like, the NHS doesn't want this stuff. They're not asking for it. And if we offer it, they're a bit like, oh, we got to pay for this, So, and I think technology also, I think the technologists, we need to build a bridge between these two sectors to say, technologically, we can do this. We can build this. This is our vision. This is what you want, but actually we could offer this. And hopefully a shared discussion amongst our community could drive something. And actually it comes back to, you and me, decent following. We've got a voice. We've got more power. And so, I'm looking to, because I'm a nobody in the system. I'm not a national leader, right? I'm a nobody. What I've seen is that I can put stuff out there and influence thinking and have national people come to me and talk to me about stuff. And actually, my job is maybe I've just got to be that guy dancing in the field, and maybe hopefully others who go, do you know what? We need a vision for tech. We need something different. Will then seek to join that dance. Maybe they won't. Maybe they will.
I love that. I think I heard on a podcast the other day that it's funny that podcasting took off because it's sort of like radio, it's sort of like YouTube videos, it's somewhere in between. It's this weird thing. And I can't remember who it was on the other side, but basically said, yeah, well, what have we lost in community is just listening to people having conversations. And actually there has been something missing there, and this has come and filled it. You can be on the fly on the wall of just two people having a chat, and that's actually quite nice. And it's funny because you're right. When you talk about, I keep using the word vision, but when you talk about your vision for a better healthcare, it's interesting how that galvanizes me. It's interesting how it makes me want to have more of these conversations that more people listen to. But you're right, it becomes a people movement. It just becomes a new, I guess, morality of like, that's not the right thing to do. Like, we shouldn't be doing that. Like the use of plastic, for example, that wasn't ever like, it started to become morally not okay the more that Leonardo DiCaprio posts about it. Like, all of a sudden then people start to think, yeah, this actually isn't okay. We as the people are going to judge a company on how much plastic they use. We as the people are going to care more about the treatment of animals and the treatment of this. And then it does affect capitalism, because then people vote with their feet. They do not put their money into people that care differently. So we know that people movements are possible at scale in different industries for different things. And perhaps then, it matters that you and I have this conversation, then we at the next event and we talk to a couple more people about it, and like other people start talking about it. And of course we're not the only ones talking about this sort of stuff, and of course we're not the only people like doing this. And I think we just need to be part of it. And
it's not a me thing. It's never a me thing. It's a we thing. Like, one of the things after finishing this last organization that was very successful and doing things very differently, I was like, was this just a freak thing that was really successful? And I started reading every book I could. And the encouragement that I have is that across society, we have a wave. It may not feel like it during the selection, but we have a wave, particularly but like, there's people like us who are thinking and, who want to think differently other than this this view. Like, here we are. We can do it. Thank you for giving me the platform to talk about this. You're
very welcome, mate. I'm going to tell you now, the one thing that I am going to take forward from this conversation is that I am going to, I actually already do feel like in my business, right, everything's my problem. And when I think everything's my problem, it's a Gary Vaynerchuk quote or philosophy, or I'm sure it's everyone's philosophy, but he's the one that got it to me. But like, if you consider everything as your fault, okay, that sucks to some degree, but actually now you've got complete agency over like everything. Like, if something with a mistake went out, and you can blame someone else, but actually it's your problem. If you consider it your problem, you now think, well, how do I fix it? Oh, I'll just put a review stage in. I'll make sure that happens next time. Once you consider everything your problem, like it becomes actually incredibly empowering. And actually that's sort of how I feel about this now. It's how I feel about, well, if we want healthcare to move to a more of a social and emotional model, if we want the workforce to be valued for that sort of stuff, I can value the workforce for that first and foremost, so that when I access the healthcare system, I can thank people for being a certain way more. I can compliment certain people for being a certain way more. I can write to the chief exec of the hospital and explain that this nurse actually treated me with dignity and respect, and I really enjoyed her company the entire time I was there, and this OT, and he was great because, like, I can start valuing that. And I think that is the beginning, right? And I can do that in my little world, and I can influence people to do the same, and I can start to attribute value to it myself, and I can have more of these chats, and I can, I can start my own revolution, I guess, is what you've inspired me.
What strikes me, James, and obviously you've been a bit more vociferous recently about some of the things that are concerning you and, that you care about. Like, realistically, we kind of, like, maybe less you, but, particularly me who works for the NHS, like, I live in a system of vested interests. And last year I had an experience, I won't say who, but like I did a couple of big articles where I really called out something which people were telling me was problematic, but no one could say, right? And like, if the staff aren't allowed to speak up in systems, and we've seen this, the whistleblower discussions at the moment, if the leadership aren't, if the population aren't being informed enough, who talks about this? And like, as you say, in that kind of agency, I don't know, last year I was always getting a bit careful around NHS England because I was advising and stuff like that. But I'm just like, do you know what? I'm going to be respectful. I'm going to be considerate. I'm not going to be a firebrand. Maybe some might consider me to be. But I'm just going to speak up for what I think is wrong, why I think it's wrong, and why I believe that try and not be a solutionizer, but to try and at least expose the problems and try and talk about some of these things, because it matters. Like, I think one of the points that I almost raised earlier was, like, what is healthcare? It comes back to the book that I was mentioning around, the expropriation of health, right? Like, it's this, particularly in the election, it's this system, it's this thing we talk about, and it's a separate thing. But it's not, it's us. It's you and it's me, and it's like, this is our lives. It is our collective individual lives that we live and support, which we have prioritized and requested, that provides us. It's not separate to us. And I think, I don't know, like, I have this view with the election that if you don't vote, you can't really complain about it. But I also feel that if I just become a passive commentator saying everything is awesome, sort of doing the little dance and stuff like that, does that just make me part of the problem if inside I'm like, I really think this is rubbish, right? And so, I'm trying to role model as someone who's maybe a bit safer, is speaking out and saying, we should be able to talk. We're like, the best way that we can improve the health system is to make a safe environment where we can have a conversation about it. And I feel safe enough doing it now. But like, if there's something where we're like, do you know what? I don't believe this is right, or I believe this is wrong, or this really concerns me, or like, I don't know, I feel in the spirit of community, individually, more wider in our country. What happens if we don't speak? What happens if we don't speak up about it?
I love that, man. I love that. And I think you're so good at doing that, particularly of late. And I think it is just important, isn't it? I think we joke about not being so early in our careers, but you're right. There's an element of safety as well. Like, there's an element of, we work with the people that we work with, and we do things we do, and we have the philosophies that we have, and our businesses have the philosophies that they have, and we'll work with the people that we will off that basis. And actually, like, we do see the world a certain way. I think we do have the best intentions. I personally as well, like I'm sure you are too, like, just so willing to learn where I am wrong. And actually, you put 400 episodes of a podcast out, of course you're going to say stuff that riles people up the wrong way. And like, I get these messages of like, something like I said like 100 episodes ago or whatever. And I'm like, look, hold my hands up, and I've learned something different since then or whatever. Like, but yeah, I do think there's an element of role and responsibility in that. And like, I think it's why there's an opposition to a government. Like, you have to have someone asking the questions. I think that's useful for a civil society. So I think that is in part our role. It is in part our responsibility. And debate
is a beautiful thing, right?
It is.
Let's be honest.
It is. No, you're right.
How do we ever enlighten our thinking if we can't have people respectfully disagreeing with? My concern is everyone shouts at each other.
Yeah.
And that we become too divided. Yeah. But good if people disagree. Yeah,
100%. Yeah, 100%. Because even if you come out of that debate having your view strengthened, and you've learned a few arguments that have even strengthened your argument, that debate's still been useful. I think if you come out feeling like it's touched a nerve, like you can go and explore that and figure it out. Like perhaps it is something that you're insecure about, or like whatever it is. Like there's so many benefits to that. I think you're right. Debate's so important. I'm actually going to do a debates evening, by the way. I'm actually going to put this together where like I put some contentious issues out and like we just debate it in a room with people with like a proper debate moderator and stuff. Nice. So I'm going to do that soon. But yeah, dude, it's been a pleasure. Thank you so much for stepping in. It's been wonderful.
For, doing this podcast that only the two of us ever get to the end of.
I'll listen to it twice. So we get 4 listens.
Yeah, me too. Very good.
Pleasure, mate. Thank you.
No, thank you so much.